Last week, the Saint Lucia Blind Welfare Association opened its doors to a Britain-based program, Sight Savers, in an effort to provide better eye care for Saint Lucians. Director of the eye photographing program, Nick White, says he runs just one of 85 programs, which engages over 35,000 people in Britain. White says his team is on island to conduct eye photographing exams, as approximately 10% of Saint Lucians suffer with diabetes. He says this percentage is alarming as it leads to diabetic retinopathy.
There are a lot of people in Saint Lucia who have diabetes, and it's very important that they have their eyes photographed once a year. We photograph the back of the eye, the retina, and then we assess those images to see whether the diabetes is affecting the back of the eye. There can be lots of changes there on the back of the eye without necessarily affecting the vision, so people won't know that these changes are going on, but the changes can be very serious. And then eventually, when it does affect the vision, it can be too late to reverse that.
Executive Director at the Saint Lucia Blind Welfare Association, Anthony Averill, says this screening process is long overdue for Saint Lucia, as loss of sight is prevalent.
With the assistance of the Caribbean Council for the Blind, we are hoping that we would be able to provide a long-term structured program that would allow us to prevent blindness through diabetic retinopathy. So the people who are being trained today is to help with the early detection side of things, so that they would be able to screen people affected by diabetes, and if any sign of diabetic retinopathy is detected, they will make referrals to the ophthalmologist, who would then determine the type of intervention necessary.
Geraine Georges, NBC News.